This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. It's Mon Health Talk. I'm Dave Wilson. Our guests this morning are OBGYN's Dr. Marlee Greschner. Good morning, Dr. Greschner.
Hi, good morning.
And Dr. Shane Prettyman. Good morning, Dr. Prettyman.
Good morning.
Well, guys, thanks for joining us. We're going to be talking about OBGYN robotics today. We'll dive into that topic in just a moment, but we have to talk about you, at least for a couple of minutes, whether you want to or not this morning. So we'll start with Dr. Greschner. Just give us some background about you, where you're from, your education, how you ended up working with Mon Health.
Okay, yeah, thanks for having us. I'm originally from Cambridge, Ohio, so a couple hours away, so pretty close to home here. I did my medical school training in Athens, Ohio, and I completed my residency training in Columbus, Ohio. My husband and I have, again, my family is close, and he has a lot of family in Wheeling, West Virginia. So we wanted to move back home. We tried Florida out for a bit, and it wasn't for us. So we found opportunities here and wanted to work in a nice community setting, so that led us to Mon Health.
And Dr. Prettyman, same to you. Tell us about yourself.
Sure. I grew up down in Charleston, West Virginia. I did undergrad in medical school in Morgantown, and then I went to the University of Virginia for residency, finished that in 2011. So after residency, I married. My wife was from close to Morgantown, so we decided we wanted to come back to, start our family a little bit closer to family and back here in West Virginia. And then doing school in Morgantown, always knew this is a place really that I thought would be, wonderful to live, wonderful to have a job in. And at Mon Health, always being, the community hospital that my family, has, had their surgeries in. My wife was born, in this hospital. Just always knew it was kind of the hospital that you wanted to work at. It's typically the hospital that people want to go to. So I thought, hey, I could come back here and get all of that stuff. So I've been back here since 2011.
Dr. Greschner, what led to your specialty in OBGYN?
Yeah, so I really figured out I wanted to do OBGYN when I was completing my rotations in medical school. It's a great variety ranging, from office practice to labor and delivery to gynecologic surgery. So the variety really attracted me to the specialty, but it's just a great field to allow for continuity of care and taking care of women from puberty all the way to menopause.
And same to you, Dr. Prettyman. Why OBGYN as a specialty?
Yeah, once I was, younger and thought, I was going to go to medical school, I always had an interest in surgery. When I was young, it may have been undergrad, I volunteered, this is back in Charleston, at the hospital, and around the operating room, I by chance kind of came across an open heart surgeon, and he said, hey, you want to come in and watch a surgery? And I'm sitting there watching an open heart surgery, just amazed at it. So I always knew I wanted to do something with surgery. So then, again, when you're in medical school, kind of going through the specialties with my focus kind of, my thoughts being on surgery, then I came across OBGYN where they do a lot of surgery, but in addition, do obstetrics, delivering babies, and that's just kind of it's kind of like two specialties in one, so you get to do a lot of GYN, which is a lot of times surgery, but then also obstetrics, which is very gratifying. So for me and probably a lot of people in our field, it incorporates a lot. There's always different stuff to do, keeps our interest, and it's a very gratifying field. So very happy to do it.
Well, Mon Health OBGYN has some exciting news regarding what I assume is surgery and robotics. So, Dr. Prettyman, I'll let you break the news. What's the news regarding robotics and surgery?
So robotic surgery. Robotic surgery is a term that's been around for probably the last 15 years or so. When I was in residency in Charlottesville, that was 2007 2007 to 2011, kind of robotics was starting there, and probably a lot of centers, and may have started more in academic medical centers. But it's basically laparoscopic surgery, which is kind of the way we've done most surgeries when able for the last 20 years or so. But it makes it done in a more precise fashion. So more precise, and we can talk about this all day long. It typically means an easier surgery, and this is the way I think about it, easier for the surgeon to do the surgery, which then means more precise, less complications, often a better recovery. So this idea of robotic surgery kind of gives you those things. So then it was, well, in what areas of medicine can we kind of add robotics in to assist with laparoscopic procedures? And it's always, urology was probably the first place it started, but then it quickly got into gynecology as well. And now it's starting to spread into general surgery, and there's some robotic orthopedics as well. But as far as gynecology, probably one of the main surgeries that gynecologists do are hysterectomies. And we typically try to do those laparoscopically, but when you can do those robot-assisted laparoscopically, that gives some advantages. And just this past year, Dr. Greschner and I have started doing robotic hysterectomies at Mon General, kind of giving our patients the advantages of just not a laparoscopic procedure, which has its own advantages, but robotic-assisted, which gives some additional benefits.
And Dr. Greschner, when you're deciding between robotic or, I guess, traditional laparoscopic surgery, what factors do you consider? What are the types of considerations you'll make when trying to decide which procedure is the best way to go?
Yeah, so specifically when determining the route for a patient, robotic surgery offers an advantage for technically difficult cases. So especially in a patient that may have had several prior surgeries and you have concern for scar tissue and things, or women with pelvic pain, that's one of our most common indications for hysterectomy, that may have something underlying such as endometriosis. The robotic-assisted approach is wonderful for those types of patients because, like Dr. Prettyman was saying, the technology of it is much more precise, and also you can actually see certain pathology a lot better. That's been one thing that's been proven in studies, especially for women with endometriosis. The 3D technology of the camera actually allows us to see better and detect that pathology. So that's one of the main points in deciding, which patients are appropriate for that.
Our guests this morning, Dr. Marlee Greschner and Dr. Shane Prettyman, OBGYN, Mon Health, Obstetrics, and Gynecology. Dr. Prettyman, so what types of procedures are we talking about here that can be offered robotically?
So technically, you could do any laparoscopic case robotically. A lot of times, if the patient has a laparoscopic tubal ligation, that's classically a very easy procedure, so that's typically not something that we would use the robot for. You just do it kind of the older school laparoscopic way. When you're doing hysterectomies, that's a little bit longer procedure. It can be a little bit more difficult procedure that you need to be more precise on. And then if patients have other indications, like Dr. Greschner said, pain, maybe the pain is caused by endometriosis, that could lead to scar tissue. Maybe they have enlarged uterus from fibroids. That can make the surgery a little bit more difficult. And those are the cases that typically Dr. Greschner and I are thinking about using robotically. If you have a patient that has known endometriosis and you're doing a surgery maybe to try to correct that endometriosis, that would be another consideration to do to use robotics for. And then in addition, and in fact we have a case coming up sooner than later, our urology colleagues that do robotic procedures often we can do prolapse procedures with robotics. So you sometimes combine that with a hysterectomy and then the robotic portion to correct the prolapse. You can do the prolapse procedures laparoscopic or robotically as well.
Dr. Greschner, for the patient who undergoes a robotic assist procedure, What are we talking about as far as recovery time, hospital stay? Would it vary based on the patient procedure, I would assume?
Yeah, so recovery in general for robotic-assisted surgery compared with traditional laparoscopic surgery, it is a very similar recovery and outcomes. Most of the time, our patients that undergo a robotic hysterectomy or a hysterectomy from the traditional approach, typically patients are discharged home the same day. It is much, of course, a longer recovery while at home, but inpatient-wise, usually same-day surgery, which is, one of the great benefits of minimally invasive surgery compared to an open procedure. One of the benefits from robotic-assisted surgery that the company, which is called Da Vinci, has provided some evidence on is compared to the traditional laparoscopic approach, robotic-assisted surgery has been found to have a reduced rate of converting to an open procedure. So on those difficult cases with a large uterus from fibroids or scar tissue or whatnot, there is a less likely that those procedures will convert to be open if you're using the robot. So that certainly can have an impact on a patient's, inpatient stay and recovery.
Our guests this morning, Dr. Marlee Greschner and Dr. Shane Prettyman. They are OBGYNs with Mon Health Obstetrics and Gynecology. Got to squeeze in a quick break. We'll continue the conversation in just a moment. You're listening to Mon Health Talk here on the voice of Morgantown, WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Our guests this morning, Dr. Marlee Greschner and Dr. Shane Prettyman, OBGYNs, Mon Health Obstetrics and Gynecology. And we've talked a lot about robotic surgery on this program, and I don't know that I've ever asked this question, so I'm going to pose it to both of you. Is it natural? You guys are obviously manipulating the tools of the robot and these very precise procedures and maneuvers, but was it natural to pick it up and pick up being able to manipulate the robot like that, Dr. Greschner?
So for, any type of procedure you're performing, obviously a large amount of training and repetition goes into that. So I had, where I completed residency in Columbus, we had a pretty thorough robotic curriculum. So throughout my 4 years, we kind of had different, steps in the process that we, went through to learn the robot. So I wouldn't say it's something I learn overnight, certainly, and I don't think your patient would want to know that either. But it definitely requires significant training and experience. But once you are experienced with that, and in addition to the benefits we've talked about for the patient, it allows a lot of surgeon benefits too. The ergonomics of it for long, difficult procedures, it has a lot of benefits for us as well.
And Dr. Prettyman, I picked up, you said robotic assist surgery. You're still there. You're still running the show. Robots are just helping out a little. Well, I don't want to say maybe a little bit, but they're helping out. They're not in charge.
Yeah, absolutely. So I think it's important, when I first, I think with most people, when you hear robot assisted, you may have all these visions of, a robot doing it and the doctor's not doing it, and are they really in control, and what happens if this? So I think I've got some pictures actually on my phone of the robot, some videos of it kind of, moving, and then kind of pictures of the console where we sit literally 6 feet away from the patient, kind of looking in these goggles. So when you do laparoscopic surgery, in the traditional sense, you're standing beside of the patient holding a straight instrument that goes through a small port, a 5-millimeter port in their abdomen, looking up at a TV screen, in front of you. when you do robotics, it's still the same in that you still start off standing beside the patient, making a small incision, putting a 5 millimeter port through their abdomen, looking up at the screening. It's just at that point you move over a machine, a robot, that then attaches to that port, and the instrument then still goes through the port into the patient like we typically would, except instead of my, let's say, shaky hand holding the instrument, right, and the very straight and rigid instrument, you have a robot that's very still, much more precise than a human can be. It's not shaking, and it also bends and articulates to give you much more finer control and much more control. And then in addition, once we have the robot set up and the instruments are in, then you step away from the patient, you sit 6 feet away from the patient, and you look into your console, and it's a very three-dimensional picture. The picture is much better than laparoscopic surgery in a traditional sense. In addition, the surgeon has control of the camera and everything that goes on, as opposed to an assistant that's driving the camera, again, maybe not focusing where you want to focus, maybe not holding the camera as still as you want it to. So there's advantages from that aspect. So those, again, are some of the advantages. But I think that when we have a chance to talk to patients and explain that to them, if they see pictures and kind of understand, they still realize that the surgeon is very much in control, and it's maybe not as artificial and scary and futuristic as, maybe they have it visualized in their head.
We're quickly running out of time here, guys. Dr. Marlee Greschner, who would be a candidate for robotic surgery?
So really any patient can be a candidate for robotic surgery. Again, we want to complete minimally invasive surgery compared to an open approach. So any patient really would be a candidate for that. Like I mentioned kind of early on in the talk, especially those patients where we, are seeing pain, possible endometriosis or underlying pathology, especially those patients. But given the benefits, really anyone is a candidate.
And Dr. Prettyman, about a minute here. As far as the patient goes, quickly, what are the benefits here to the patient to using robotics assist surgery?
Yeah, I think in general, I think a lot of women have indications for needing or having a hysterectomy. I think a lot of women, they just kind of deal with their pain, they deal with their bleeding for a long time. As most women, they put their family and their kids and everything else first. And I think a lot of women that if they actually sit and come and talk with us, they realize that, the way we do hysterectomies now are much different than their mother that had a hysterectomy 20 to 30 years ago. If I think a lot of our referrals come from friends of patients that we have already done surgery on, when they're talking to their friends and they're realizing that they had surgery and they were going home 3 hours later, and that they were back at work within a week of surgery, and that they had a little bit of discomfort for a few days, and that was about all. And it was very similar to when they had their laparoscopic tubal, 5 years ago. Realistically, the recovery is the same. That's when they realized, what? I could do the same-day surgery, be back at work very quickly, have minimal downtime, and not have to deal with all my issues for the rest of my life. Women, time and time again, when we see them after surgery, they say, best thing I ever did, I should have done it a long time ago. And I think if most women realize that, hear it from friends, come make an appointment and talk with us about that, I think that they would realize that, this is something that they are a candidate for too, and they could benefit from too as well.
Our guests this morning, Dr. Marlee Greschner and Dr. Shane Prettyman, OBGYNs, Mon Health Obstetrics and Gynecology. Of course, you can always get much more information, including contact information, how to make an appointment. Go to monhealth.com/OBGYN. Guys, thank you very much for the time today. I find the robotics to be fascinating every time we talk about it on the show. Thank you so much for the time. Appreciate it very much.
Thank you.
Thank you.